Hi, I'm Molly. I'm going to be doing an IV insertion. When I first enter the patient's room, I perform my hand hygiene, and then I go ahead and identify them with 2 identifiers, date of birth and their name. I then would go ahead and ask them if they have any allergies. After asking if they have allergies, I would ask them which hand is their non-dominant hand. I would go ahead and use that for my IV insertion. I would also make sure they don't have a mastectomy on that side. After I have chosen which arm I was going to use, I would go ahead and palpate which vein I would use. After there's no pain or tenderness at my vein, I would go ahead and place an alcohol swab over which vein I chose. And then I would go and perform my hand hygiene and apply my gloves. I'm going to prime my connector tube. I'm going to perform aseptic technique by alcohol swabbing each connector part. I have a pre-filled syringe, and I'm just going to make sure the normal saline flows through. My connector is primed and there's no bubbles, which means there's no air. And then we're going to alcohol swab the vein which I'm using. And as I allow that to dry, I'm going to go ahead and apply my tourniquet 2-3 inches above the vein I chose. Nice tight tourniquet, easy to release. I'm going to check the radial pulse. Radial pulse is present. I'm going to take my 20 gauge needle with the bevel up. I'm going to insert at a 15-degree angle. I have blood return. Once I see blood return, I'm going to go ahead and insert another 1/4 to 1/8 inches. I'm going to apply pressure with my non-dominant hand and take out the needle. I place the needle in a biohazard bin before I leave. I'm now going to take another alcohol swab and now attach my connector tube. I'm going to release the tourniquet, and with the push-pause method, I'm going to insert 3 mL of normal saline. Once that's done, I'm going to clamp the connector tube and disconnect my syringe. At this time, I'm going to apply my dressing, which I already have labeled. I would label with the date, time, initials, and my 20 gauge. Needle on there. Once that's on, the dressing is over the hub and the insertion site. I'm going to add chevron tape around to secure the tubing line so the patient doesn't tug it out. I'm going to place this connecting tube comfortably on the patient's side. At this time, I'm going to document the arm I chose, 20 gauge, date, time, initials, as well as how many sticks, the patient's response, and any education.